Good afternoon, dear friends. Welcome. Welcome to have you here. Thank you so much for making the time to be with us today. So we are going to start a webinar to share the lessons of the framework for dialogue methodology that was used in Uganda and Nigeria. My name is Gracia Violeta Ross. I work with the World Council of Churches, leading the HIV and other pandemics program. And I'm going to moderate this session. We are going to hear from this methodology, then from the experiences in Uganda, then Nigeria, and we will have a conversation with the presenters. And we also want to hear from you, your experiences in responding to HIV stigma. You can put your comments and questions in the chat. We will be reading them and try to have as much as possible time to respond to these questions. We are going to begin with a word of prayer, and then I will introduce this methodology to yourselves, and then we will hear from Uganda, and next from Nigeria, and then we will go into a first round of questions and answers. So I'm going to start with the prayer. I hope you can all follow in your respective faith traditions. Dear God, we thank you so much for this opportunity to learn from one another. We know HIV stigma is one of the main barriers in the HIV response. We want to put our hearts, our minds, and our hands together in order to create safer spaces and justice for people living with HIV. We thank you for the faith communities that are already leading this response, and for the willingness to work with people living with HIV around the world. We want to review 2 examples from Uganda and Nigeria today. We ask that you bless this session and that you open our minds to learn from one another and to multiply the good work. This is part of your mission. This is part of the work of God in the HIV response. Thank you so much. Guide us through and bless all participants and panelists in this webinar. In Jesus' name we pray. Amen. So let me start with the presentation of this methodology. We call the webinar Changing Hearts and Minds, Uganda and Nigeria in the Fight Against HIV Stigma. We realize that fighting HIV stigma is not just an issue of facts, having the right information of how HIV is transmitted, but it's also an issue of putting our hearts ready to change. I have seen in my 23 years living with HIV that many people, although they have the information, they still prefer to discriminate. And that is because, I don't know, they feel there is the possibility that they are happier if someone else is not. So we shouldn't follow that path. And this methodology is called the Framework for Dialogue. It has been created by UNAIDS, the global network of people living with HIV and other partners, in order to respond to the persistence of HIV stigma, particularly in the faith sector, but not only. Those of you who are connected to HIV work or who live with HIV, you know how difficult HIV stigma is and how much it is in the practices, in culture, in the health settings, families, and also faith settings. So I will explain this methodology, and then we will hear the practical application that it has. The Framework for Dialogue methodology, what is it? It is a methodology, it's a tool to dialogue and to take joint action at national level. The purpose is to develop a long partnership between religious leaders and networks of people living with HIV to eliminate HIV stigma together. There are many things that can happen on the side of the faith sector, on the side of the networks of people with HIV and NGOs working on HIV, even the government. But the idea is to do things together. The size of the challenge is so much that we always need to work together in HIV response. The main mechanism of this methodology is to analyze the evidence, have a dialogue on the evidence, and then decide joint action. Particularly the Stigma Index some of you might know that the global network of people living with HIV are producing the stigma index in many countries, and sometimes for the third time, for the second time. So this is a study, a design study to measure HIV stigma. And the results of this study come to our knowledge, but then what we do about it. So the idea is to take this stigma index and other evidence that the country produced on HIV stigma, have a dialogue between the faith leaders and the communities living with HIV and other sectors like the NGOs or the key populations or the most affected communities, civil society organizations, and develop joint action plans. This methodology was developed by UNAIDS, the World Council of Churches, the Global Network of People Living with HIV, and the International Network of Religious Leaders Living or Personally Affected by HIV, which is INERELA. They did this work in 2011. So the idea of this methodology is to develop strong, lasting partnerships between faith leaders, faith-based organizations, and people living with HIV. We realize that there is a critical role, particularly for the faith leaders, to challenge and to eradicate HIV stigma. But we don't do this just out of nothing. We use the evidence, which is the evidence that the country produces. And there is a lot of evidence, not only the HIV stigma index, but there is other evidences as well. And well, I told you already this, for example, the International Community of Women Living with HIV in Uganda, they do a scorecard of the services that are provided for women living with HIV. The Nigerian network of religious leaders living with HIV, they did a study of the perceptions of people living with HIV among the faith leaders. This is also evidence that we use. And any other document that has been written by scholars, academics, etc. So there are principles of this framework for dialogue. One is that it's owned by the country. So it doesn't have to be an organization from Switzerland. It could be the World Council of Churches or any other to tell the country what to do. But it is the country that already has this information, that analyzes and has a discussion. Then they decide what should be done to eradicate HIV stigma. In HIV work, there is a lot of prescription in some actors and a lot of direction, do things in this way. But this is not the case. The idea is that the country leads and owns the methodology, the discussion, and also the interventions that will be proposed after the analysis. Second principle is that it's based on evidence. So this is not just goodwill, but we are looking at the evidence. What is the evidence saying? Which groups are the most affected by HIV stigma? And then the responsibility of reading this evidence. If the evidence is saying that, for example, young people are the most discriminated, stigmatized, then we should have actions with this group. But this implies all the groups, probably also people who are doing sex work, or men who have sex with men, or transgender communities. The third principle of the framework for dialogue is that it's centered on people. It is not centered in the National AIDS Program or the UN offices or the international organizations like the World Council of Churches. It's centered on people, what people need, how people are being left behind, what is happening to women, to children, to young people, to men, to adolescents, etc. Another important principle is the do no harm principle, which means we come to the dialogue not to judge each other, not to say, oh, this is why you got HIV, or if you did this, but this is from all the sides. So the faith leaders should not judge the communities, but also vice versa. There is also a lot of misperceptions, misunderstandings of the faith leaders. I have seen that some communities living with HIV were surprised to learn how much commitment there is in the faith leaders already doing work on HIV. So the do no harm applies to everyone. We come to a table which is an equal space in which we talk with our knowledge. Some bring the knowledge of the public health, like the AIDS program. Some bring the knowledge of the community, like the networks of people living with HIV. Some bring the knowledge of the spirituality, like the faith leaders. Another principle of this methodology is that the participation is equal and meaningful. I told you already about this. We are not bringing a table in which the faith leaders are here and the people with HIV are down there. No, we are trying to put all the identities that bring power to us to a rest for a while, and then to have a conversation between people who are living in the same country and who are working on HIV, trying to create a space in which everyone can be heard and their opinions are taken as important. This is very crucial, because then otherwise it's prescriptive. And I can tell you that the faith communities that I have seen are very ready to take this path of dialogue, an equal dialogue with the communities living with HIV. This will always bring positive transformation for the faith leaders, but also for the people living with HIV. And then another principle is innovation. We will be challenged to do things in an innovative way. What was useful 20 years ago in the HIV epidemic might no longer be useful. The epidemic has changed a lot over these 40 years. We have to be ready to propose new things that will make sense for people who need them. For example, young people who are living with HIV today, some are very young. What do they need? How are they feeling excluded from the spaces? How can we integrate them in ways that are meaningful to them? And another principle is that this dialogue is action-oriented. We don't dialogue just to have an intellectual academic conversation. We dialogue to have actions together. And together is important, because if we keep doing things on our side, we will achieve the same results, but we want to achieve more. And that's why we need collaboration. And the last principle is that this is a safe space. It's not a space it's a space that will guarantee confidentiality of the issues. Conversations will not be shared outside the place if people are not agreeing to that, and that we know we can say what we need to say and we are still okay, without the fear of being judged or stigmatized even more. I think when we gave these principles in the two countries, it worked so well. And also, years before, this methodology was implemented in other countries. Later on, one colleague that is working with UNAIDS PEPFAR will join the meeting, and she will share a little bit of how the methodology worked some 5 years ago in other countries, apart from Uganda and Nigeria. So this is what I wanted to share about this methodology. And I wanted to tell you that after having this methodology discussed amongst ourselves, the World Council of Churches invited the international community of women living with HIV in Nigeria and the Friends of Canon Gideon Yamugisha Foundation in Uganda to do this framework for dialogue for HIV stigma in Uganda and Nigeria. And we are now going to hear from them and how it happened, what they learned, and what issues were identified in both countries. We are going to start with Ruth Ninsiima from the Foundation of Friends of Canon Gideon Yamugisha. Ruth is from Uganda. She's been working with HIV for so many years. She's an expert. She's also a supporter of the international community of women living with HIV, and now is leading the foundation in Uganda and has been a key person in the framework for dialogue, along with Canon Gideon Yamugisha, who is a faith leader in Uganda, very recognized in the world for his work fighting HIV stigma, not only now, but since the beginning of the epidemic. So Ruth, you can start your presentation.
Thank you. Where I am, it's evening. Good evening, friends, ladies and gentlemen. My name is Ruth Ninsiima. as Gracia has introduced me. I'm glad to be here with you this evening. My presentation, allow me to, okay, my presentation begins from there. I want to start you off with sharing that photo, that photograph where we gathered at the national meeting together with Gracia and many other members of that participated in the national meeting. Like Gracia said, I work with Friends of Canon Gideon Foundation, located in Uganda. So what is Friends of Canon Gideon Foundation? It is an NGO that we trace our origin in 1992 when the Reverend Canon Byamgisha, who is on this call right now, tested and openly declared his HIV serostatus as positive. So around that time, there was a lot of stigma, but a group of family and friends gathered around him and supported him to defeat that stigma. And in that, we formed a fellowship, which later turned into Friends of Canon Gideon Foundation. Our vision is to have HIV defeated, and those are some of our objectives. Mainly, we exist to support the work started by Canon Gideon in defeating stigma. We also exist to support the young people, orphans, and vulnerable children with skills that can enable them to be productive and live healthy lives. So most of the background about the framework for dialogue has been given by Gracia. So in that partnership that we entered in with the World Council of Churches, we formed a committee, the National Steering Committee. Some of the members on this call, we had Reverend Father Achmandrit Mbonabinji, who was the chairperson. That one comes from the Uganda Joint Christian Council. We had a representative of the Muslim Supreme Council. We had a representative of the international community. We had a representative of the National Forum of People Living with HIV Network, and many others. As you can see them, we had UNAIDS. Sarah Naku should be joining the call soon. We had Uganda AIDS Commission, represented by Ms. Hope Moronji. Yeah, so those are some of the people I've been reading. Some of them are in that photo that was taken during one of the steering committee meetings. I must say that most of these meetings took place in the Uganda AIDS Commission. So that is Uganda AIDS Commission boardroom, and we are really grateful. So the framework processes, we had 3 steering committee meetings. We had one on 1st, on 7th, and another one on 14th, and another one on 21st of June. Then to conclude all the work of the framework processes, we had a national meeting, which we did between the 12th and 13th of July, 2023 at Uganda, at Eureka Hotel, Uganda. And this meeting was attended by 30 participants. As you can see, 20 female and 10 males. So in the national meeting, we specifically had a representation from the following. We had networks with people living with HIV in Uganda, such as UNERELA. UNERELA is a Uganda network of religious leaders living with or affected by HIV. We had National Forum of PHA networks. We had young people, an organization of young people, and FOCAGIFO. We had human rights representatives, that is a Uganda network of HIV ethics. We had a COEP constituency, that is key population. We had faith-based institutions. We had the Uganda Joint Christian Council, Uganda Muslim Supreme Council. We had the Orthodox Church of Uganda, the Orthodox Church, and the Church of Uganda. Then we had women advocates. These included the International Community of Women living with HIV in Eastern Africa. We had Action for Coalition and Action Uganda. We had Women at 40. We had Ministry of Health representing government and Uganda AIDS Commission together with the Ministry of Gender and Labor and Social Development. We had UNAIDS represented together with UNESCO. We had theological institutions such as the Uganda Matters Theological Training College in Namugongo, and we also had Global Fund sub-recipients who were represented by the two organizations. That is one of the meetings we had in the boardroom for steering committee. During the national meeting, we identified several priority areas because, like Gracia put it in her remarks, that the framework for dialogue is mainly to identify priority areas and then you identify joint action plans. So in all these processes, our aim was to identify these issues based on evidence, like she said. So we looked at through the Stigma Index of 2019 and many other evidences available about stigma, and through discussions, group discussions and experience sharing, several priority areas were identified as follows. We had a group that talked about stigma and the young people, and these came up with issues like miscommunication and poor education messaging on HIV and stigma in the church. This is very clear, especially for the young people, that the church still looks at them as maybe if you have HIV, you're sinning or what, or you're fornicating. So we realized that was miscommunication. Then inadequate information about stigma, its causes, forms and effects by the adolescent girls and young women. Again, this was identified that even the girls themselves don't know what is stigma and how they can get stigmatized. We realized there was an issue of absentee parenting, where parents have become so busy chasing their professions and hardly find time to talk to their children. We also had a denial of service provision due to pastoral teaching, such as provision of condoms by Catholic-based health centers. This came out vividly that in some health centers, especially if they are owned by the Catholic Church, you will not find condoms, you will not find contraceptives. Then another group identified issues to do with stigma in the faith communities. And it was discovered that some religious leaders still discourage their congregation from taking HIV medication, claiming spiritual healing. Others still look at HIV as a curse, while others still confuse what is right from what is safe. Religious leaders have gone ahead to push for the introduction of laws that stigmatize some groups of people living with HIV. There was also an issue that there is need to change the narrative about HIV inside the faith communities. There was this whole issue of HIV stigma and the law. And in this, we agreed that actually stigma is being perpetrated by the stigmatizing laws, such as the law on HIV transmission. In Uganda, we have a law on HIV transmission, and it usually gets on with the women. By the time somebody goes through the case, in most cases, women are held culprit. The Anti-Homosexuality Act, which was signed this year in May, also stigmatizes not just the the LGBT community, but all of us who work with them, who support them, who give them services. There is a lot of ignorance about laws and how they affect HIV service delivery. That came out very, very clearly, that some of the religious leaders actually don't know the effect of these laws that they are sometimes pushing for. Those are some of the priority areas. And then, of course, like we said, we needed to look at the joint action plan. So now that we have these challenges, we have these issues, what are the things that we can do together as groups present? So we agreed that we need more sensitization and training of religious leaders to become voices of love and hope, enabling them to differentiate what is right from what is safe through seminars, workshops, and the rest. Then we also agreed, I beg your pardon, we also agreed that churches should develop and saturate pastoral letters with non-stigmatizing messages. We agreed that this should be actually taken on by the Interreligious Council of Uganda, which should give a pastoral letter to every church about the right messaging, what should be said in church and what shouldn't be said. And members felt there should be messages that particularly target young people. But we also said we need, we are going to introduce young people specific programs such as youth camps, sensitization workshops about HIV and stigma. Again, this came out from the fact that there is a gap, an information gap among the young people. And people felt we needed those young people specific programs that would create more sensitization. Then conduct roundtable discussions between parents and young people to discuss the role of parents in addressing HIV stigma among young people. Again, that came out very, very vividly to close that gap between the young people, especially people living with HIV, and their parents. There is a way they are getting detached. Conduct interfaith programs that address these differences and promote cross-learning. We also agreed that we should hold sessions and dialogues on HIV stigma and integrate in communication guidance, but also agreed that we need to scale up the love, the care, the protection through providing psychosocial interventions as an integral part, because you don't have to have a hospital to give psychosocial care. Each one in our own capacity, we can provide that psychosocial support. Conduct roundtable dialogues with religious leaders on issues of HIV stigma and the law, and develop, disseminate, and explain the different laws and how they affect service delivery with the religious leaders. We also agreed would develop, print, and disseminate messages of love, equality of access, and equity for HIV services. Actions continued. We agreed we are going to organize a retreat with members of the consortium. The people who met at the national meeting agreed to form a consortium, and we agreed to categorize ourselves in 11-member consortium. So we agreed to do a joint retreat and also hold a joint annual review to take on these things that we agreed in July. We also, this is on how we plan to move, because we identified those action plans, but then what? So this is how we plan to implement those things, that we will have at least once a year a meeting with all the people that we gathered with in July in form of a joint annual review. But we also conduct interfaith prayer services to mobilize these people, the members of the consortium, but also the rest of the faith community, to raise the spiritual and financial and in-kind resources needed to support stigma reduction activities. And also moving forward, we are going to ensure participation of in other national and regional, international level advocacy, networking, and collaboration. And I'm glad to inform members on this call that today, up to Thursday, we are attending the Uganda National AIDS Symposium organized by the Uganda AIDS Commission. And these are some of the things that we agreed we need to encourage participation. And specifically tomorrow, FOCAGIFO is going to take a total of 30 religious leaders to attend the symposium, to learn from the symposium directly and interact with other people there. Next steps for Uganda, therefore, is that we agreed that the Interreligious Council of Uganda remains very, very crucial in faith community issues, and therefore them together with the Uganda AIDS Commission needed to complete the rollout of the National HIV Action Plan. This action plan was actually supported by UNAIDS, and FOCAGIFO together with Uganda AIDS Commission did this in 2021, but we still feel it has remained on the shelf. We feel it's a time that we need to work with these very key strong partners to have it rolled out countrywide, and then support the church community, the faith community, on how to actually apply the action in the faith sector. Then also suggest that the Ministry of Education, together with the IRC, Ministry of Health, the Uganda Joint Christian Council, should empower and mentor teachers and health workers and many other partners who are working on HIV to give stigma reduction and gender-based violence programming for faith, so that the faith sector gets empowered, gets to know what is right as far as addressing gender-based violence is concerned, what is right as far as stigma is concerned. We also agreed that the consortium would engage the government of Uganda to uphold non-discriminatory laws that have a potential to inculcate stigma and discrimination. And on this, we have actually begun engaging. On 22nd this month, we are going to have a meeting together with the UGANET. UGANET is actually on this call. We have a meeting where we have religious leaders together with the people living with HIV, receiving the judgment that we got over one of the pastors in Uganda who has been stigmatizing young people, who has been stigmatizing people with HIV. So recently he was taken to courts of law, and we were PLHIV, civil society won the case. So we now want to have a meeting where we bring this person, this particular pastor, and also bring different other religious leaders and dissect this case and show these people the things that actually sometimes they do, not knowingly, that they are stigmatizing people living with HIV. We also agree that the Ministry of Health and Uganda AIDS Commission offered us venue for more meetings. So Gracia, anytime we are going to be having several other meetings, because at least we have that free venue from Uganda AIDS Commission, we have that free venue of Ministry of Health, and recently, again, Ministry of Health engaged us directly. He has engaged Friends of Canon Gideon, and particularly Reverend Canon Gideon Yangisha, to be on a community. It's like a community policing committee. He's on the call. When it's time for discussion, he can tell us about this. But what I must say is that the framework for dialogue has given us more platform, more time to engage with these very strong partners. So we have some lessons learned. One of the lessons learned was that the framework for dialogue helped us to identify the priorities and also propose joint action plans. Because, for instance, we've had the stigma index for several years. The stigma index that we reviewed was for 2019. But since then, we had not had, any close intersection of this and understanding it. But the framework for dialogue helped us to identify areas that we needed to concentrate on from that stigma index. This process also introduced new and renewed existing partnerships. Like I said, surely after that process, our relationship with the government and intergovernment has gone to another level. We are identified, okayed, and engaged. The other day, I had a whole week implementation activity with Uganda AIDS Commission. Next week, Canon Gideon is with the Ministry of Health. It is a renewed commitment that, yes, these people knew we were there, but the fact that we engaged them in this sensitive activity showed that we were still determined to fight. We also realized that actually churches will now use the framework for dialogue action plan to mainstream HIV and AIDS in their work plans. At least people will not say we don't know what to do. We have identified all these things and brought them to light. So it is going to be easier for the faith community to mainstream the thing. And finally, the National Steering Committee that was formed was also the consortium that was formed was such a lesson that actually most of these things, you cannot do them alone. We needed this consortium, and I'm glad that we are surely moving together. In conclusion, members, I would like to appreciate the World Council of Churches for the technical and financial support towards these processes. Particularly, I would like to appreciate Gracia. Gracia, thank you so much. And I say this from the heart. You know what I mean. Gracia has been there right from the word go. She will not allow you to make any mistakes. She will guide you. And we thank you and we appreciate. We appreciate members of the steering committee, those who are on the call. I saw Raymond, I saw Immaculate, I saw Crash. Mariam, I think, has joined. And also the national facilitator, Reverend Canon Gideon. We thank you so much for leading us through this very sensitive work. I want to appreciate the 30 members that participated in the national meeting. I want to give a very big thank you to Uganda AIDS Commission for hosting us for the 3 steering committee meetings we held. And finally, Gracia, allow me to appreciate my colleagues at the Secretariat that have given me all the support ever since we started the writing of the concept up to where we are. Thank you so much, members.
Bravo. Bravo. Thank you so much, Ruth. I think we really have to appreciate UNAIDS. I should have said this earlier. UNAIDS is the one who funded this work, and they channeled this money through the World Council of Churches. I think they are in the call, so UNAIDS has a priority working with the community. So thank you so much, Jacek and Francesca. I think she's already or will join at any time. But also all the members, all the partners in Uganda, and particularly the Friends of Canon Gideon Yamugisha Foundation. You all did a great work. I know the context was not very was what it was given the new law, but you still had the conversations, and I see how brave you are, and I can witness this with all the participants. You are very good, and you managed to keep the relationships with all the partners. So you really deserve an applause, and I think people have already put on the chat a big applause for everyone in Uganda, particularly the Friends of Canon Gideon Yamugisha Foundation. Well done.
Thank you.
And more to come. We are going to leave the questions for the presentation after the presentation of Nigeria. So now it's also my pleasure to present Helen Aphan. She is from the International Community of Women Living with HIV West Africa. She's a board member, she's an activist. She's been doing this work supporting communities living with HIV, particularly women, for a long time. And ICW West Africa, International Community of Women Living with HIV in West Africa, was asked to help us in doing the framework for dialogue, and this activity is concluded in August. So now she will bring a presentation of how the framework for dialogue happened in Nigeria. Go ahead, dear Helen.
Thank you. So my name is Helen Aphan, a member of the International Community of Women Living with HIV West Africa, Nigerian chapter. And just a quick introduction. I work for support group and also the Association of Women Living with HIV in Nigeria. Our umbrella network is the network of people living with HIV in Nigeria. I'm more of a community person because I know that so many people do not have access, especially those in hard to reach areas. And those are our focus for them to access their HIV care and treatment as much as possible. So basically, I'll be talking along that line. So the International Community of Women Living with HIV and AIDS is the only international network run by women living with HIV and AIDS that promotes all our voices and advocates for the changes that improves our lives. International Community of Women Living with HIV was formed based on desperate lack of support, information, and services available to women living with HIV and AIDS worldwide. And for these women to make input on policy formulation and development. Basically, that is why we are more active to speak on behalf of other women who cannot fight for their rights. So why the framework of dialogue? Why was it held?
Sorry, Helen, I think you need to move the slides. We are still in the first slide. We are not seeing the next slides. Okay, now, yes. Thank you.
Okay, like I said, the International Community of Women Living with HIV was formed based on desperate lack of support, information, and services available to women living with HIV and AIDS worldwide. And for these women to make input on policy formulation and development, we have to actively come in to assist. So we work basically to give information to women in the grassroots, other women living with HIV who do not have information and access to services. And that informed the existence of ICW in West Africa, specifically in Nigeria. Can you see the slide, please? So I go ahead. Can I go ahead?
Go ahead, now we see.
Okay. So why was the framework of dialogue held in Nigeria? We came out, the steering committee came out with some issues, and we specifically indicated stigma and discrimination as the reason why intake of services has a barrier, so to speak. So stigma and discrimination contribute to 75% withdrawal for HIV treatment and other social services, including religious gatherings. So from the stigma index that I will, in the other slides, I will explain how the stigma index brought the report on the effect of stigma. We were able to find out that people have refused to come out and go and access their treatment because they are afraid of stigma or being stigmatized by the health facility, by their neighbors, by their relations. and others have refused to go to churches, mosque for prayer because fingers will be pointed at them as having HIV. So some of these people actually indicated the reason why they cannot go out to access some services. Another point is that people living with HIV go through a lot to achieve viral suppression. They have to cope with depression, they cope with stigma, they cope with a lot of things to achieve viral suppression. They have to fight self-stigma and make way to get their viral suppressed. And as we also know, ARV reduces disease progression. So with stigma and discrimination, some people do not adhere to drugs, so they withdraw from going to access ARV drugs. And adherence plays a pivotal role in successful HIV management. And for you to be well and healthy, you must take your treatment 100%. So adherence play a very vital role. 95% of persons living with HIV are comfortable talking with their religious leaders. And if that platform is compromised, we know that they will not be making demand to get their services, either in health facilities, in social gathering, and a lot of other societal influence. So experience of stigma and discrimination according to typology. Some children never experience disclosure, exclusion from family activities and social gathering has been witnessed by many. Female respondents suffer stigma more than their male counterparts. As we know, in Nigeria and probably in some part of Africa, women are more burdened with HIV status than their male counterparts. And before diagnosis, their ability to socialize emotionally was better off than when they disclosed. And some, because of their disclosure, have lost their marriages, have lost relationship, and it has affected them morally and emotionally. So from the stigma index, according to the typology report we got, 9.4 of the respondents choose not to attend social gatherings at all. 11.9% decide not to have sex because they lacked information and they were still battling with self-stigma. 64% of respondents delayed up to 6 months to go for their HIV test. 42% commenced treatment upon HIV seropositive test results. Some will, assert their faith, and they want to, confirm that the churches have prayed for them, the mosque, the religious clerics have prayed for them, so there was no need taking any HIV test or a confirmatory test. So they have decided not to commence treatment at all. And this, we discover, is as a result of stigma. So the purpose of the framework was to provide enabling environment for partnership with faith leaders in collaboration with people living with HIV and other stakeholders. Conversation that borders on faith and HIV-related issues were also discussed at the dialogue. So how the framework of dialogue went, it was a consultative meeting with people living with HIV, people living with disabilities, key population, faith-based institutions, international network of religious leaders living with HIV, and some other key partners that joined the dialogue. It was held in August. It was a 4-day meeting, 14th to 17th. And the organizers were World Council of Churches, International Community of Women Living with HIV, Active Voices. In attendance, sorry, we have 44, sorry for the typographical error. We have 44 participants in attendance.
I think
And
we
this was more, sorry?
I think we needed the next slide. Thank you. Yeah, you already passed it. Sorry.
Yes. This is a typographical error. I'm sorry about it. Can you see this slide?
Yeah, we see.
Okay.
So we're saying it was 41, not 14. Yeah.
Yes, sorry. That's an error from the computer. Sorry about it. So the dialogue was basically moderated by Reverend Ushishi, a cleric of the church in Nigeria here, and Gracia. So it was an existing point for HIV programming discussion. And in attendance were the Muslims, the clerics from the Islam religion, people living with HIV, active voices, the whole faith communities represented at the meeting, Muslims and Christian faithfuls. So the priority issues identified, this is not inexhaustible. There a lot came out, but we just picked this so that I can just discuss it on this platform. So some of the issues identified were stigma and discrimination across service delivery points, some religious institutions, and close relations. And this was informed by the Stigma Index that was sponsored by the Global Network of People Living with HIV. And this was anchored by the Network of People Living with HIV in Nigeria. So the stigma cut across all the service delivery points, the religious institutions, and other neighborhood and relations across board. So redress and legal action as enshrined in the Anti-Stigma Act. And the past president of Nigeria actually assented to the Anti-Stigma Act, and discussion was on the stringent measures that actually can be met on perpetrators who stigmatize people living with HIV. And this discussion was on, but it was also noted that it was not properly domesticated, and the implementation process was actually not strong in Nigeria. So the situation of women and adolescent girls living with HIV in Nigeria was also very key. It was a large presentation at that. So in Nigeria, 1.4 million people are living with HIV. Out of this number, 56% of them are women. So this is how critical stigma and discrimination plays a very negative aspect in the lives of women living with HIV in Nigeria. And we'll also discuss the perception of the keep-up by religious institutions and the society. The females, the sex workers, men who sex men, the transgender came up with vital points on how they can actually be accepted by the society, especially the religious institutions. And this was also issues that were identified. These physically challenged and special persons living with HIV find it very, very difficult and stressful to access HIV treatment. So we talked about getting everybody involved, not leaving anyone behind. And the physically challenged persons actually came out with some issues that is stressful to them in accessing HIV treatment. So the four key pillars for persons with disabilities were also itemized. The church and mosque leaders who put down strategies of compulsory HIV tests before intending couples are joined in marriage is a conversation that was very heated. For churches and mosques to demand for HIV test results of intending couples was something that has actually affected so many relationships. And this is one of the discussions that went a very long time for us to discuss, and we came out with a way forward. So ethics of priesthood, confidentiality, and listening to all, especially the critically sick, is something also that was discussed. So we had presentation from the government of Nigeria, represented by the Federal Ministry of Health, and a cascade of the HIV situation in Nigeria was presented. Having the HIV subpopulation in Nigeria, the adults, the key population, HIV treatment thematic areas, differentiated services were discussed. So the outcome of the stigma index as presented by the network of people living with HIV in Nigeria has the following outline. The limited chain referral system. The limited chain referral system has also caused a barrier to accessing comprehensive and affordable HIV services. 64.1% of respondents were female at the stigma index. And this calls to mind that women have the health-seeking behavior better than men. And because they want to keep their homes, they want their children to be alive, they want to be alive to take care of their families, they were able to respond to some questions as relate to stigma in accessing care and services. 12.3 respondents were not sure of their partner status. We have this slogan in Nigeria that men don't go to the hospital, they are taken to the hospital. They are either driven to the hospital or are forced, are coaxed to go to the hospital. So they don't seek any health, they don't have any health seeking behavior as much as the women do. And 53.3% were assumed not to have disclosed or not aware of partner status at all. So the burden of responsibility of caregivers is more on the women. Yes, this is what was recorded in the stigma index. And 9% of respondents were said not to meet up with their daily needs as a result of, staying back to take care of their house chores, taking care of their sick children, as much as taking care of their sick husbands. So they were not able to meet up with their daily needs of going out to even seek for how to get ends meet. Some of them are traders, some of them are civil servants, and they are restrained from going out to get their daily needs. 96.1% of participants are formally educated. Illiteracy status in Nigeria is somehow high, especially in the rural community. So 96% of participants are formally educated. 2% as asylum seekers and refugees. Yes, those are, we have issues of insurgency in Nigeria, security issues, and sometimes there's migration from one point to the other. And some that were, interviewed during the stigma index exercise were asylum seekers who provided some information too. Issues of disclosure was also very key. Some respondent status were disclosed without their knowledge and consent. And this is something that is not proper, because if we deal with the anti-stigma law in Nigeria, you do not have to disclose someone's status without that person's consent. And that calls for stringent measure. So some respondents were able to come out with that their status were disclosed without their consent. 49% were accepted by social circles and friends. Disclosure has generally not been easy, according to some respondents, because some say if they disclose to their partners, they lose that marriage. sorry. And some respondents don't have the compassion to relate better with people living with HIV who disclose their status. And those are so many of the issues that the Stigma Index came up with. Healthcare intersections. Yes, we have issues even in the health care platform where caregivers and clinicians actually do not have a friendly approach to clients who come to seek services. So having said that, we have so much discussion around stigma and issues that came up that we identified, and some religious clerics gave recommendation as a way forward and how to manage the situation of stigma and discrimination. Some of the recommendations were different preventive measures to be used instead of abstinence, that we should not deceive ourselves. If you say you are abstaining from sex and you actually have it in mind to have sex, that is not true. We should create another way to, give information about safe sex and not to actually tell people to abstain totally. And that we should also encourage our members and congregants to take their medications while praying too. Yes, the religious leaders have a role to encourage their members to adhere to their drugs as much as they are praying. Do not pray and stop drugs. And don't take drugs and stop praying. As you take your drugs, you should also pray. The problem of HIV have gone beyond drugs and ARV. It is important for us to be healthy physically and mentally. That calls for mental health issues. Yes, as you are on your drug, you should also be physically and mentally fit. We discussed about mental health issues relating to HIV, stigma, and discrimination. Misinterpretation of the word in the Holy Scriptures, both Bible and Quran. The scriptures should not be read constructively. Don't read the scriptures and apply them according to your thoughts concerning scriptures. The scriptures should be read constructively. You shouldn't read the scriptures and apply them according to your thoughts. They should be applied constructively. And that was a statement from the clerics that were present. And we must also address and correct the myths through education, awareness creation, dialogue, and so many others. We should correct the myth and misconception of HIV as relates to people. You shouldn't say the people got HIV because they are sinners, because they have refused to serve God, or because they are promiscuous. We should also educate our members that HIV can be gotten through so many ways. It can be through mother to child, through unsterilized sharp objects, and some other ways. You don't need to put it on them that they are sinners, and that's why they are HIV positive. So plan on priority areas that were identified. We intend not to leave anyone behind, and all-inclusive support is recommended. And we also plan to advocate to stakeholders, and especially the Federal Ministry of Health in Nigeria. Stigma and discrimination as a barrier to accessing HIV services. As a result of that, we also intend to discuss with the Health Management Board of the health facilities that provide services for people living with HIV in Nigeria. Key population are humans and should be considered as such. We hope to work with all persons in their diversity, including the key population and people living with disabilities and others. Revisit HIV counseling and testing as a parameter for consummation of marriage. We intend to also discuss with the religious leaders to also give guide on how to give the HIV test before marriage and how to present the pre-test and post-test counseling better. So what happened next after each meeting, such as this? We need to have an all-inclusive agenda. We don't need to leave any group behind. Henceforth, we are going to collaborate with various stakeholders, including the religious leaders, community gatekeepers, the youth, the women, and all those who are drivers of HIV response in the community. Collectively address complaints from persons living with disabilities. There was a case from a state in Nigeria, Niger, where people pay as much as $8 to get treatment. That is 8,000 naira. Because as we speak, the dollar translates to $1 translates to 1,000 in Nigeria. So for as much as that, for each consultation, some of the people living with a disability in a part of Niger State pay as much as that. And this is something we have taken to the Federal Ministry of Health to address. So other highlights during the conversation was award presentation. Award of appreciation was presented to Gracia. Award of excellence to Reverend Sister Cecilia, the Executive Director, Catholic Action Committee on AIDS. Award of dedication was presented to Reverend Ushishi. Award of excellence to the Chief Imam, Adeyemi Mosque, and Chief Imam of one of the mosques in Nigeria, Alhaji Adeyemi. Award of dedication also was presented to Reverend Father Moses of the Catholic Church of St. John the Cross in Nasarawa State. So basically, this is one or two of some of the pictures that are held. We have some picture with Keep Up here. We have a presentation, pictorial presentation from different groups that was held. And we have the regional director of the International Community of People Living with HIV just on the top, making giving her keynote address in the picture here. So some lessons learned was that we should have discriminatory policy for persons with disabilities. Having presented all the cases, having gone through issues, there's a need for discriminatory policy for persons with disabilities. If the physically challenged can't get their drugs easily in the health facilities, let the drugs get to them. So we are looking at differentiated service delivery to ensure that drugs get to them as at when due, and they should not be deprived of treatment as a result of financial constraints. Religious institutions play a vital role in the eradication of stigma and discrimination. Inclusiveness in planning, decision-making, and implementation of HIV projects at all levels is very key. So these are some of the lessons learned, and we hope to work with all that was discussed effectively. So thank you very much. Thank you. Thank you,
Bravo.
over.
Thank you so much, Helen, and thank you all the organizations and communities, faith leaders, and the ICW and Active Voices, the Christian Council of Nigeria, and all of the partners that participated in Nigeria. They are very active, very dynamic. So I'm sure they will make a lot of activities following on the plan. Bravo to Nigeria and to Uganda. Now, before we go into the questions, I wanted to give some space to Jacek or Francesca from UNAIDS. I don't know if Francesca is in the call.
Hi.
Okay.
Hi,
Go ahead.
Thank you so much. And thank you so much for the presentation. I could join only when on the presentation from Nigeria, and it was really excellent. I'm very pleased about everything that I've heard. Just to say that, addressing stigma and discrimination is, of course, one of the key priority of the UNAIDS Path for Faith initiative. And we are very pleased to work with the World Council of Churches and all other partners that have been involved in implementing the framework for dialogue in Nigeria and in Uganda. I have a few just comments to make. Because we have been implementing the framework for dialogue since mainly 2013. And one of the key elements of the framework for dialogue is collaborative aspects. And it's the capacity of bringing together different organizations and different voices, and the fact that it really uses evidence as a starting point. So from the presentation from Nigeria, we really had clear what were the key issues that the stigma index in Nigeria identify as priorities, and it's very important that the entire group focus on them. And then in terms of specific outcomes of this methodology, what it is important is the work plan, which is a joint collaborative work plan where all the different partners involved identify specific responsibility that respond to their specific capacity and the capacity of their constituency. So I want to take the example of the obligation of HIV testing, the mandatory testing that is imposed by some of the faith groups, the churches, congregation, and mosques, etc. I think that, for instance, from the presentation, it was clear that that is identified as one of the major barriers, and it's definitely a stigma cause. I'm very interested to hear and understand if the group has identified specific action to be included in the action plan to address this important issue. So, for instance, could you gather information regarding the rule and policies that exist in the different congregations? Could you gather all of them together? Could you identify faith leaders, champions that can help supporting and changing such policies? Could you help with a working group composed by the different organizations and people who are part in the framework for dialogue, draft what actually should be a policy to support and promote HIV testing in places of worship, but that does not stigmatize people? And then could you identify a sort of action campaign for follow-up where this activity can be implemented? What it is really important in the work plan is to be very clear about which are the congregations and churches and groups that are involved, where do you want to bring about change in the policies, and what it is the policy that you are offering for change, and who are the faith champions you want to involve. And on the base of this information, I think that the responsibility of the UNAIDS Path for Faith initiative is to make sure that we have support for follow-up, because this action is very concrete and is gonna really make a change. Another important piece that you mentioned in the presentation is about the people with disability. So what are the concrete actions that are necessary within and among those that you have described that can be detailed in an action plan, in a work plan, and that we can help support, including identifying other resources and partners to support them? And then I have two more pieces, and then I stop. I just get very excited about the work that you are doing and leading on. In the past, the framework for dialogue took place in several countries, including in Kenya, for instance, or in Malawi or in Ethiopia. And in each of these countries, the outcome has been different because the starting point is different. The stigma index results were different. So in Ethiopia, the issue identified was a lot around elimination of mother-to-child transmission and stigma against children and women. In Malawi, it was more around homophobia. In the countries is really different, and in each country they really came up with specific work plans and clear deliverables. At the point that in Malawi it was developed a work plan for churches to engage with people from key population groups and faith champions to address homophobia. So it's this kind of activities that are really important to be identified so that we can then support the follow-up, as our colleague was mentioning before. And then the very last point is about, I would really like, and I here ask Gracia to help me with, to have a multi-country sharing experience of all the organizations that have been involved in the years in the framework for dialogue, so that we can really bring together all the lessons learned, the challenges, and shape the best way forward. Thank you.
Thank you so much, Francesca. So we see how this conversation that started in Uganda and Nigeria is now moving like the globe to discuss about this, and I think this is very important. So Ruth and Helen, keep these questions that Francesca mentioned. You know, what things could be done to respond to the issues identified in the framework for dialogue? What champions could there be? What congregations? And she said that the UNAIDS PEPFAR will support the do some activities to support. I also told you this, and this will be in the plans of WCC with support of UNAIDS for next year. At least one activity, if possible, 2 of the plan in Nigeria and Uganda will be supported. But then we also have, I will give you the word, Ruth and Helen, to respond all the questions together. We have 2 questions already in the Q&A. So Taufik Adelay is from AIDS Healthcare Foundation. He says, it is impressive, the many things that are being done. There seems to be many things going on. I, however, want to inquire the mechanisms to monitor and evaluate these processes. So can you think about some mechanisms already designed in Uganda and Nigeria to follow up and to see and to monitor the process? And then a second question is, very interesting presentation which highlighted the framework for dialogue in Nigeria. It will also be nice to see how partnerships are leveraged to implement some of the action plan from the framework for dialogue. This is also applicable to Uganda. Oluchi Ndobuisi says stigma is deadlier than the virus itself, and I think that can never be overemphasized. I am thinking we hold same kind of trainings, summits of awareness programs on HIV stigma and how badly it affects people affected by this virus. As we all know, stigma is one of the major reasons people don't want to speak up, because it ends up in more stigmatization. While we are talking about implementation policies and getting perpetrators to face punishment, it is very important that more countries get to train religious leaders, as this is a major way to get to many families, because everyone home has this reverence for religious leaders. So is there a plan for more trainings on the issues of stigma for Nigeria, Uganda, and other African countries? Yes. In fact, the framework for dialogue will be hosted in DRC, Democratic Republic of Congo, next year. And you heard Francesca, she's saying we need a multi-country sharing experience. I think we can do this next year. It will have to be online, I'm afraid. And then we'll continue supporting at least some activities of Nigeria and Uganda. But also the idea is that these are adopted, owned by the country, no? We don't depend on the World Council of Churches or UNAIDS, but this is our own thing. Yeah. So Ruth, Helen, are you ready to provide some comments on these questions?
Okay. Can I?
Yes,
okay.
Go ahead.
The first speaker asked about getting the faith leaders champion to walk around the HIV test for marriages. Yes, we hope to work with them. We have written to them, and they are aware of our collaboration. We hope that the World Council of Churches, in collaboration with UNAIDS and some other partners, can come up with a plan for training. We need to talk to them one-on-one so they understand how we feel. So there's a need for training and retraining of those champions who can actually go back to their congregants and give the right information, especially on HIV testing, disclosure, and also consummation of marriages. So we hope that we work better with the faith leaders who we intend them to be champions that could actually go to their other denominations to give them the right information. And then you talked about persons living with disabilities getting their treatments, right? Now, we also hope to collaborate with persons living with disability. At the dialogue, we actually exchange contact and we have been communicating with each other. We have asked them to send us any reports and we'll forward to the Federal Ministry of Health. But further from that, we hope to, visit them from time to time to monitor how services are given to them in the health facilities where they access the treatment and some other basic needs around the community they live in. So we intend to intensify our monitoring and evaluation to come up with stringent measures for any, for any treatment given to persons living with HIV that is not human. And also for countries who are doing well, I know that the East Africa is actually responding well as much as the HIV response is. We intend for exchange visits so that we share ideas. We learn what works, what's not working, what should be improved. And this is the plan we hope to put down, and we are looking forward for some sponsors from UNAIDS Global Fund so that we can share idea and be on the same page in HIV response space. So Mr. Taju is asking about the mechanism we have put in place, in identifying these issues. Yes, after the dialogue, we hope to intensify the community-led monitoring response, especially around service delivery points. Yes, we hope to improve on the community-led monitoring, and we want the women-led network to be more actively involved in community-led monitoring. In my presentation, you heard me say that 56% of people living with HIV in Nigeria are women. So we need more services that can actually help us to live long. So if the community-led monitoring project can also be given to the women network in Nigeria, I think we'll do better. I think we'll come out with very, very good success stories. And this is something we are looking up to, and we are begging Global Fund and UNAIDS to please come up with measures for us. We have issues of pediatric HIV in Nigeria, and these are some things we can actually deal with if we respond positively to issues around treatment, people with prevention of mother-to-child transmission, pediatric HIV, and what have you. So we hope that partners, donors can sponsor that community-led monitoring mechanism for us to do well. Thank you.
Yeah, thank you so much. I wanted to add to Nigeria that the World Council of Churches, looking at the plan that came out from Nigeria, we already mobilized other resources, not from UNAIDS, but from Kerkinacti, to work on one issue that was identified in the framework for dialogue, which is HIV self-stigma among young people living with HIV. This is an activity we just completed 1 week ago. And with UNAIDS support, at the end of November, we are going to do rights literacy training for women living with HIV. The majority will be young women living with HIV, which is an activity in the work plan of the Nigeria. And when you speak, Ruth, I would like please to ask you to explain a little bit more about this case that you were saying was won by the communities of people living with HIV. But hold on, please. Let me give the word to Jacek, because he might not be able to stay the whole the rest of the webinar. So Jacek, you can talk now.
Okay, thank you very, very much. I will try to be as short as possible. I hope you hear me, yes? Perfect. Okay, so just 2, maybe 3 brief comments, because I really like what Ruth and Helen are providing us, because this shows, based on the methodology that you introduced at the beginning, that these 2 processes are really going very well. Comment number 1. We do hope for this process to be a process, not just one-time consultation, which means that absolutely crucial is to have a kind of action plan after, yes? Like a work plan between the meetings. And please, I'm hearing dozens, if not more, super critical issues mentioned for both Nigeria and Uganda. I would strongly recommend that, like in other successful places, we do have like 2, maximum 3 issues identified on which faith partners and networks involved concentrate as their kind of work plan between now and next round that will happen in 6 months. And 6 months from now, they could report the meeting, the consultation could start with reporting what we achieved, what we delivered in the meantime. Yes, so this would be comment number 1. As a possible tool, because I see it in the questions and also in presentations, a possible tool for where to connect this activity into the response at country level would be the FBO action plan. As I understand, we have both in Uganda and in Nigeria, and both of them are co-owned, co-run by the National AIDS Program, meaning the governmental institution. So this is the probably good entry point where once a year you could report on success stories, but also challenges of the framework for dialogue, where the much wider scope of partners could be aware and could be accordingly involved. And from this one, we are, I am building a bridge to the 3rd comment that Helen is very rightly bringing to the table. Yes, UNAIDS will continue supporting both processes in Uganda and Nigeria and will open in a couple of other countries. Of course, supporting the processes based on action plan that will be presented, yes. But I think that one of the biggest advantages of the framework of dialogue is that if we properly do it, and it seems we are on track in both cases, in both countries, we could relatively easily then connect it to the sustainable funding from the Global Fund or from PEPFAR's COP in the country. And this way, we would ensure that our faith partners are playing more sustainable role in our national or local response, while the priority issues with networks of people living with HIV and key populations are addressed. So I stop here with these few reflections for both countries and for like wider audience, because I'm really pleased to see so many people interested in the topic. All the best, bye.
Thank you so much, Jacek. You are wonderful support to the communities in UNAIDS, as well as Francesca. Thank you so much. Now, Ruth, I give you the word. Try to think a little bit about this case that you were mentioning that was successfully won by which is a legal case, by the communities of people living with HIV, but also tell something about I forgot the name, the steering committee in Uganda got this. What is the name that it got? I forgot. Sorry.
Which one, Gracia?
The steering committee in Uganda adopted another name, which the name now went out of my head.
The consortium.
The consortium, yes. So
yes.
talk about how the consortium is working or will work, which is a mechanism of monitoring progress already. So go ahead, dear Ruth.
Thank you. Thank you very much, members. First, I want to start with the comments from Mr. Jasek. Thank you so much, first of all, for the support once again, and for the assurance, for reassuring us that this is not just a one-time of activity, but it is a process that needs to continue identifying areas and addressing them. And we promise you, we are going to continue tracking these priority areas and following them up. I want to thank you for that guidance that we look at least 2 or 3 activities or priority areas and concentrate on them as a country in this, and we will definitely do that. Going back to our questions, one was about what are we doing about marriage certificates, religious leaders who insist they want to see a marriage certificate, I mean, a testing results for testing before marriage. I think that was the question, that we still have religious leaders who still perceive HIV in that perspective, that for me to wed you, I need the results. But what we are doing about that, and like we said earlier, that in this we are leveraging resources left, right, and center. So recently we worked with the UNAIDS country program here in Uganda to engage religious leaders directly, top level religious leaders. And these are some of the things we address with them when we meet them, when, you know, these are things, because for instance, that is an issue to do with policies. So you cannot address policy with grassroots religious leaders, much as they are our allies, we are together in most events, but when it comes to policy issues, you have to target the high level. And as you can see in that something that we've shared, those are the people that we are targeting. For instance, in July and August, we met, those are high level. The first one is the head of the Muslim section in Uganda, first from the left, that is His Eminence Mubaje. Then we met the head of the Orthodox Church of Uganda, it's called his Metropolitan Musei. Then the head of Uganda Joint Christian Council. So those are people you meet for such policy issues, and we are going to continue engaging them to see how we address some of these things. And then we also want to follow up most of these things again through messaging, because we believe most of the issues we are having is the stigma is because there is some gap in the messaging. Yesterday, Colonel Gideon was on Aphan TV, and he gave a very brief but catching story message where he said there is no prayer that is going to make you understand your HIV status. Please go and test and get to know your status. Even if you pray 20 times or 30, no prayer is going to reveal the HIV status of yourself or of your partner. So those are some of the messages we want to emphasize and print and disseminate wherever we can reach, whenever we have the resources. That you can see some of those messages that we've shared. You know, these are things we've worked on and disseminated countrywide with support by UNAIDS. So again, that is one way we can follow up some of these things. But also, in my presentation, I talked about a pastoral letter. Members who met at the national meeting emphasized the use of a pastoral letter. A pastoral letter is a letter that comes from above. You know, if you're, for instance, Anglicans, then that letter that comes from the Archbishop, and it is giving guideline on what to say about HIV and when and how. So those are things we need to follow up and ensure that some of these priority areas can really be touched. So thank you so much, members. We are engaging, like one of you asked whether there is actually something that is already being done. Yes, because after the national meeting, we did not sit back and say, hey, we finished the meeting. We got some resources to engage the high-level religious leaders. You can see in that photo that was in August. We engaged, the top leaders, Mothers Union, Fathers Union, but at high level, at their stand level, at archdeaconry level. And these are the same things we are telling them, because when you talk about stigma and you don't address those people who own offices, then you're not doing it right, because they're the ones that have the office, they have the authority to change something. They have the authority to integrate something. For instance, if you're a head of a Fathers Union and you have monthly meetings as Fathers Union, if you are educated and empowered about stigma, then you can integrate something in your meetings. So that's the direction we've taken as Friends of Canon Gideon, to continue engaging at every other opportunity. Our focus is on religious leaders, and we will continue to engage every level at grassroots. Like I said, tomorrow we are taking grassroots community religious leaders to the symposium. So that is at grassroots level. You want them to understand these things, but also we continue moving up until we meet those heads, their heads at the top, like I shared. Gracia, just before I go, you had said I talk about the case. So that there is a case. The pastor in point is Pastor Sempa, is a famous pastor, a youth pastor. He's actually based at Makerere University. But his attitude, his personal attitude towards HIV is really, really negative. The way he perceives people living with HIV is so negative. Like when the young people living with HIV are having those beauty pageants and having their ceremonies, for him, he calls it, he pursues it as if it is, you're promoting HIV. Why are you making people living with HIV celebrate? Why are they participating in competitions? I think for him, he wants to see people living with HIV in a certain cage somewhere, not participating in anything, not happy, not smiling. So whenever there is something nice in the HIV community, for him, it is a no. Why are they doing that? They're going to make other people envy them, yet they are not supposed to be envied. So recently, when he made a very negative remark, CEHAD is the Center for Human Rights Development in this country, together with some individual activists, took up the issue and went to court. They've been in court, I think, for about 4 to 6 months, and recently a verdict was passed, and he had lost the case. And so, and his lawyers were like, no, they are going to Court of Appeal and what. But now for us as religious leaders, that is a plus. And we are saying it shouldn't just end at that. We now want you to use that as a case in point, as a success story, to share with other religious leaders, but also to use it as a learning point. So we call these religious leaders and educate them why actually it was a point of stigma and why this gentleman has lost the case. So we are calling it intersecting the case, cutting it one by one. And our lawyers, we have UNAIDS, they are going to present to the religious leaders and show them how everything started and how it ended, what religious leaders need to know, what they need to avoid, and how they need to relate with people living with HIV. So that's the event that I alluded. It is on 22nd this month. We are arranging it together with UNAIDS. Thank you.
Okay, thank you so much, dear Ruth, dear Helen, and thank you again, Jessica and Francesca. So we have time for maybe one more question. Anyone is needing to say a question or a comment? No? Everything is okay? I have to say that I told colleagues in Uganda and Nigeria to specifically invite some people, you know, people living with HIV, faith leaders, but I didn't mention the people living with disabilities. It didn't pass through my mind, but they both included people living with HIV who are also living with disabilities. So the inclusion already was happening before the framework for dialogue happened, and I think this is very, very important. So this is a learning for me from Uganda and Nigeria. And also the learning of just keeping the topic, you know, keeping the hope, keeping the smiling, keeping fighting, even when we face people like this pastor who is unhappy because some people with HIV are happy. We had planned my colleague in the World Council of Churches to give us final remarks and a prayer, but he might be still on his way coming from an ecumenical institute where he had to give some lecture. I don't think he's on the room. Manoj Kurian, you are? I don't see him. So in that case, we are going to ask Canon Gideon Yamugisha from Uganda to say some concluding remarks, because he was really the pioneer of fight against HIV stigma when he disclosed living with HIV, being a faith leader in Uganda many years ago. So he will give us some remarks and the final prayer to conclude the webinar. So Gideon, Canon Gideon Yamugisha was the lead to do this work in Uganda. Yeah, but this is this task. But since many years ago, he started the fight against HIV stigma in faith communities with a very passionate and dedicated work. I learned many things from him. So it's a person that anyone needs to know and learn from him. So please go ahead, Canon, your concluding remarks and final prayer.
Thank you very much. I can really see how God equips the saints for the remaining work in the last mile as we head towards 2030 to end HIV, AIDS epidemic as a public health threat. The good news is that we have the science available, and now the stigma index has shown us what needs to be done. And the framework for dialogue process is also showing how to do it. So I am very, very confident. Like Jessica has said, in the next 6 months, we will be reporting more and more progress. Partnership and collaboration is the way to go. And I'm glad all the, both the presenters have emphasized it, how partnership and collaboration between faith communities, government, non-government, intergovernment, and the PHA, the people living with HIV/AIDS, that partnership produces results. And I know I'm really confident that the God who started it all will bring it to completion. I was, World Council of Churches organized a meeting in Nairobi just before we held the 11th Assembly And in that meeting, 3 things were emphasized, which I think as we continue the framework for dialogue process, we should not miss. One is to ensure that in everything we do, there is theological reflection and prayer. Prayer moves mountains. Prayer breaks walls of stigma, of shame, of denial, of discrimination. And the second thing I learned from the Nairobi meeting is that there should be practical accompaniment of people who are positive or who are struggling with vulnerability. And most of these vulnerabilities are intersecting. The one vulnerability leads to the other and they become multiple. So empowering them, skilling them, and accompanying them, especially the young people. The research we have had on stigma and the evidence available shows that children and young people are really struggling with treatment, with prevention strategies, and so forth. So our practical accompaniment strategies, let them focus as we do the framework for dialogue. And the third one I learned from Nairobi was all of that should be accompanied by joining advocacy at national level, at regional level, and at global level, so that we can reduce the incidence to ensure that less than 10% of our total people who are living with HIV feel stigmatized. The other 10 is that less than 10% of adolescents and young women and girls, plus the key populations, feel violated and feel stigmatized and feel exploited. And the last 10, which I had Uganda comment on also, is that less than 10% of the countries that are highly burdened with HIV have punitive laws. I'm sure we would be very happy if we can report on the progress of how we are partnering with others to ensure that we drop the punitive laws and replace them with the ones that are progressive, ones that are that bring transformative justice, redemptive justice that makes sure that you don't blame someone who needs love. You don't stigmatize someone who is already sinned against, because in terms of power, in terms of love, you know, he's been sidelined by those who have power, so that he's now among the last, the least, and the lost to power. God bless you. Let's end with a prayer. Dear Lord, you gave us this assignment, and we are so grateful to hear from Nigeria and to hear from Uganda as they work with the international faith community, together with World Council of Churches, UNAIDS, and all other partners that are ensuring that we get results, and continue empowering us for this journey, so that we don't only defeat AIDS and end it by 2030, but we sustain the end even beyond 2030. Amen.
And amen. 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 Thank you so much, Helen, Ruth, Canon Gideon, Jacek, Francesca, Walter, and everyone, each one of the persons who attended the webinar, and every organization, network, NGO representative that attended the Framework for Dialogue. It was a very important activity. I learned a lot in Uganda and Nigeria, and I really love these two countries. I want to keep working with you as many times as possible.
Thank you.
Okay, so see you soon, let's say, somewhere in Uganda or Nigeria.